Before going into a couple pulmonary disorders, let's review the different patterns of ventilation. Normal breathing is called eupnea. When the respiratory rate and/or respiratory volume is increased in response to metabolism, like in times of exercise, that's called hyperpnea. Hyperventilation is when the respiratory rate and/or volume is increased, but not because of changes in metabolism. You can see some of the examples there, so during an emotional response or blowing up a balloon, etc. Hypoventilation is a decrease in alveolar ventilation, which could be due to disease. We will discuss restrictive lung disease later. Tachypnea is rapid breathing like panting. Dyspnea is difficulty breathing because of disease or hard exercise. And last of all, apnea is when a person stops breathing. This could just be from holding your breath or because of something obstructing the airflow. We're going to talk about these obstructive lung diseases now. Let's briefly examine some clinical details. Obstructive lung diseases are due to inflammation which restricts breathing. Some examples of this type of disease are asthma, which is a condition where the inflammation occurs in the airways of a person, and those airways produce extra mucus, which obstruct the person's ability to breathe. Asthma can be minor or it can cause major attacks depending on the severity. Emphysema is another one of these diseases. It is a condition where the alveoli themselves are inflamed, which block the air from entering and exiting the alveoli efficiently. And then also there's chronic bronchitis, which is caused by inflammation of bronchial tubes, which then produce a lot of mucus, leading to a phlegmy cough. This leads to difficulty breathing and also, like I said, the cough. This is caused by cigarette smoking. That's the most common cause, but it can also be caused by breathing in air pollution, fumes, or dust over a long period of time. These three diseases all fall under a more general term of chronic obstructive pulmonary disease. When looking at the volume of air entering and exiting a person with an obstructive lung disease, you'll notice that the waves are not symmetrical like on the graph of normal breathing. This part of the graph shows that it takes longer for someone with a pulmonary obstruction to exhale their vital capacity than someone who does not have that obstruction. These graphs show more of the differences between obstructive pulmonary disease and normal breathing. Because obstructive pulmonary disease is a condition that causes a difficulty in the expiration of air from the lungs, the forced expiratory volume at 1 second, or FEV1 as it shows on these graphs, is decreased. Normally, the FEV per vital capacity is greater than 90%, but it is less in the patient with the obstruction. Next, let's focus on what occurs in patients with restrictive lung diseases. These diseases are due to a decrease in compliance of lung tissue, or in other words, a decrease in its ability to stretch. Restrictive lung disease occurs from scar tissue buildup, inadequate surfactant production, and muscle weakness. These can occur from disorders such as interstitial lung disease, obesity, scoliosis, or neuromuscular diseases such as muscular dystrophy or amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. Notice in these graphs how the inspiratory reserve volume and the vital capacity are much smaller than normal because the lungs are restricted in their ability to stretch and take in air. To end this video, here are some graphs comparing normal breathing, obstructive pulmonary disease, and restrictive pulmonary disease, showing the volume of air exhaled over time in each of the patients. Notice how the obstructive patient has a hard time exhaling, but the volume in the lungs of the patient is normal. On the other hand, the restrictive patient does not have much of an issue exhaling, but has a smaller than normal volume of air to exhale because of the inability to inhale the normal volume.